criteria on whether to take a person on as a patient or not. And what we do, that's the most important thing right now. Do you mind if I get into that a little bit?
I would love that. Yeah, that would be my follow-up question.
Yeah. So obviously what happens years ago, we would inject all comers. Hey, come on in. This is miraculous. We're going to inject you. And then we started seeing a pattern of people not getting results. So my nurse practitioners now are trained, and it's my job to get them to train both in ultrasound guidance and injection technique. But it's not, it's more of who we push away that gives us the best results. So if you come to us with a high inflammatory load, okay, let's say we do a blood test on you, which we like to do. We don't do it with everybody, but we have people that come to us that are very sick and their inflammatory markers are high. So their homocysteine high, C-reactive protein, insulin, maybe their hemoglobin A1C is high, they're pre-diabetic or they're diabetic. That means their body's basically on fire. And if they're on multiple medications, if they're obese, we're going to put this product in and their body's going to be so inflamed that it's going to be very difficult to put out the fire. Follow me?
Mm-hmm.
So what we want to do is we want to find people, ideally, that aren't super sick. Excuse me, it's my Kona coffee. Did I say I'm in Hawaii? I'm not sure. We want to find people that aren't super sick, that have joint dysfunction or pain in an area. And then we'll look at it under ultrasound guidance and we'll see what we see. And then we want to inject under ultrasound guidance. So what happens is there's three things around the country that if you're listening, you have to be very aware of. There's labs that are run by poor players, people that are out for a money grab, and they're not run by scientists. And again, I work with a scientist. He makes all the product himself. Dr. White does. So we want to make sure we have a good product for one. That's number one. I've been to the lab. Ask your doctor if they've been to the lab, if they've seen the lab. I know doctors around the country that are using product that are made in garages presently still. Okay, this is still happening. And they don't even know it because they haven't visited the lab. So my job is to bring people down to neobiosis. I bring doctors down there all the time. And so we check out the lab, we make sure everything's great. Now here, that's number one, a good lab. Number two, we want to make sure that the person isn't super sick, right? And number three, we want to make sure it's done under ultrasound guidance. So make sure that you have a doctor or nurse practitioner that is actually looking at it with a live diagnostic tool. Then the results of that office will go through the roof.